A pleasant day to everyone. I'm Arvin J. A. Bautista and I'm here to present our study entitled Comparison of Objective Tumor Response using CDK4/6 inhibitor plus endocrine therapy versus endocrine monotherapy in luminal A and B advanced breast cancer, a meta-analysis. Our study will try to answer the following question. Are combination therapy of CDK4/6 inhibitors, which are the current first-line therapy for luminal advanced A and B breast cancer with either fulvestrant or aromatase inhibitor, better in terms of objective tumor response compared to endocrine monotherapy? This meta-analysis will focus on the specific objective tumor response of CDK4/6 inhibitors in combination with aromatase inhibitors or fulvestrant, the current first-line therapy for ER-positive and HER2-negative advanced breast cancer, and discuss whether results correlate on current evidence on the primary endpoint of current clinical trials, progression-free survival. Our research question is itemized as follows. The following are the outcomes of the study, which include the objective tumor response parameters, the clinical benefit response, objective response rate, and the toxicity. The primary objective of our study is to compare the various CDK4/6 inhibitors combination therapy in terms of objective tumor response as one of the clinical endpoints in oncology clinical trials versus endocrine monotherapy of either aromatase inhibitors or fulvestrant in luminal A and B advanced breast cancer, specifically complete and partial tumor response, stable disease, progressive disease. The following are the secondary objectives of the study. The following is our methodology outline. The following is the study search diagram based on PRISMA guideline. The following are our inclusion and exclusion criteria. The following are the characteristics of the randomized controlled trials that were used in this study. The following shows the summary of the risk bias assessment of the studies used. For the results of our study, there is no significance between CDK4/6 inhibitor compared to the endocrine monotherapy in terms of achieving complete tumor response. However, there is significant higher probability of achieving partial tumor response when using CDK4/6 inhibitor plus endocrine therapy. Like complete tumor response, there's no significance in obtaining stable disease whether combination therapy or endocrine monotherapy is used. Likewise, there's lesser probability in CDK4/6 inhibitor plus endocrine therapy of attaining progressive disease. In terms of clinical benefit response, there's greater probability of achieving it when patients receive CDK4/6 inhibitor plus aromatase inhibitor or fulvestrant. Based on objective response rate, also there's greater probability of obtaining it when patients receive CDK4/6 inhibitor plus aromatase inhibitor or fulvestrant. However, in terms of toxicity, there's lesser toxicity when patients receive endocrine monotherapy over the use of the combination therapy. In conclusion, in terms of objective tumor response in luminal A and B advanced breast cancer, patients, CDK4/6 inhibitor plus fulvestrant or aromatase inhibitor has a higher probability of significant clinical response due to decreased tumor burden, which correlates with current evidence on prolonged progression-free survival. Thank you very much.